everyone, in this video we will discuss about pharmacology. Coming to the origin, the word pharmacology is derived from the Greek words pharmakon meaning drug and logos meaning knowledge. Definition: pharmacology is the branch of medical science which deals with the drugs, their sources, appearance, chemistry, preparations, actions and therapeutic uses. It may be called allopathic metra medica. It describes the action of drugs on the general system or on the individual parts of the body in health. Coming to the branches, there are two branches in homeopathic pharmacology. One is pharmacognosy and other is pharmacodynamics. And coming to the pharmacognosy, this term originates from the Latin word gnosia, which means the knowledge of drugs. Definition: it is the science which deals with the history, source, cultivation, collection, preparation, distribution, identification, purity, preservation and commerce of crude drugs of vegetable and animal origin. And coming to other branch, pharmacodynamics, it is one of the branch which helps us to acquire knowledge about the dynamic actions and effects of drugs on healthy organism. It constitutes the fundamental aspects of homeotherapeutics. It consists of objects and results. And coming to procedure for ascertaining disease producing power, they are homeopathic drug proving, toxicological findings, laboratory investigations. First one is homeopathic drug proving, with investigating the pathogenic power of a medicine on a healthy person. Toxicological findings are poisonings and overdosings. And coming to laboratory investigations, in laboratory, before administering the drugs in varying doses, it is experimented on lower animals to assess their effects in different organ or organs, and the others drug action on the human beings. Chemical action, depending on the chemical affinity which exists between drug and body tissue. This action is recognized by Hahnemann as primary action. And next, mechanical action. This is exhibited by the effect of the body to throw away the offending substance due to mechanical action. For example, mechanical action of Ipecacu anha, the offending substance is thrown away by vomiting from stomach. This is recognized as Hahnemann as primary action. And next, dynamic action. Dynamic actions are those actions whose technically know how cannot be explained but the effects are perceived. These actions are observed by their effects. These dynamic effects are of generic and specific. This action is recognized as secondary action by Hahnemann. And coming to primary action, every agent that acts upon the vitality, every medicine deranges more or less the vital force and causes a certain alteration in the health of the individual for a longer or a shorter period. This is termed as primary action. Although a product of the medicinals and vital powers conjointly, it is principally due to former power in aphorism 63. Secondary action. To the secondary action, the automatic defensive reaction of the vital force against the primary action of the drug is called secondary action. It may be of two types. They are secondary counteraction and secondary curative action. And secondary counteraction, when an exact opposite condition of primary action is possible, the vital force reacts equally and opposite to the primary action. It depends upon the principle of contraria contraris curenter, which means opposite cures opposite. And coming to secondary curative action, when an exact opposite condition of primary action is not possible, the vital force indifferentiates itself and employs its increased energy to extinct the medicinal disease, which gradually decreases and thus ultimately regains health. It depends upon the principle of similia similibus curenter, which means like cures like. Coming to drug actions on healthy human beings, drugs administered in excessively large doses. In large doses, drug produces secondary action in addition to primary action, wherever in drugs administered in moderate doses rarely produce secondary action. They only produce primary action, with the exceptions in cases of narcotic drugs. In moderate doses, even narcotic doses produce secondary action. And drugs administered in infinitesimal doses never produce secondary action except in idiosyncratic persons. From aphorism 116, we know that symptoms produced by the medicine varies. Some symptoms produce more frequently in many individuals, others more rarely or in few persons, some only in very few healthy bodies, to the other category being the so-called idiosyncrasies. Coming to the difference between homeopathic pharmacodynamics and pharmacology of old school. In homeopathic pharmacodynamics, the prover is healthy human beings, whereas in pharmacology of old school, the provers are lower animals like gonia pig, rat, mice, monkey. Doses. In homeopathic pharmacodynamics, there may be large, moderate, small or infinitesimal doses, whereas in pharmacology of old school, they are physiological or massive doses. Coming to objects, in homeopathic pharmacodynamics, to study the individual actions of drugs over and above its general actions produced due to specific dynamic action of drugs that was lying latent and which constitutes the fundamental aspects of homeotherapeutics. And in pharmacology of old school, to study the physiological and toxicological effects produced due to chemical or biological properties of drugs, whereas result. In homeopathic pharmacodynamics, it contains subjective, objective, both of common and determinate value and uncommon peculiar symptoms of physical and mental spheres, and by careful and methodological observations of those symptoms, thus one proceeds for proper individualization for such a good simillimum, whereas in pharmacology of old school, it contains only common symptoms. Thank you.